Gabapentin may be given to you if you have seizures, nerve pain, or restless legs. It is a medication that belongs to a group of drugs called anticonvulsants. It is popular with many brand names like NEURONTIN and Gralis. Gabapentin can be used for a variety of conditions, although it was initially approved for the treatment of epilepsy. However, the use of this medication and dosage are not similar in all such conditions. Therefore, before taking this medication, you should know very important information, like whether it should be taken as a single dose or in multiple doses, what to avoid with gabapentin, which precautions should be taken, and how it affects your attention and thinking. In this video, let's explore all such information, including discussion on how to take it and how it works. Gabapentin can reduce pain that is associated with excessive activation of a few neurons. When a few groups of neurons fire excessively, they may generate pain. This condition is known as hyperalgesia. People who had a chickenpox infection previously may have a risk of shingles. It is the reappearance of a zoster virus infection that causes a painful skin rash. Even though the rash disappears, the pain may persist for a few months. It may be due to damage to a few neurons in your body after shingles. These damaged neurons send incorrect signals to your brain. This leads to a perception of pain that lasts for several months. This condition is called postherpetic neuralgia. In such people, painful skin can be observed at the area of the rash. Increased sensitivity to touch, a sensation of burning and itching may persist. Gabapentin can be used to treat this condition. It works by reducing the transmission of pain signals to your brain. As it blocks calcium channels in neurons, they are less fired. Gabapentin can also be used for a condition called restless leg syndrome. It is a condition that causes an irresistible urge to move legs to get relief shortly. It is more pronounced in the evening and at night. The risk of this syndrome increases with age. Twitching of the legs at night may significantly affect sleep. Gabapentin can be given to treat this condition. How is it given? Gabapentin is available in different dosage forms for ease of administration. It is available as a tablet and a capsule. You may be given this medication differently based on its purpose of use. The dose on the first day is given at low levels to minimize the side effects. For example, in the case of epilepsy, it is given at a dose of 300 milligrams on the first day, 3 times at equal intervals. However, for postherpetic neuralgia, it is given a single dose of 300 milligrams on the first day. The dose is gradually increased to the desired level, which is again variable based on its usage. Your doctor will assess the maintenance dose that is suitable for you. You can take this medication either with or without food. However, you should maintain the same time every day for a better clinical response. Especially when it is used for treating epilepsy, you should not maintain a gap greater than 12 hours between 2 successive doses in a day. If you are taking extended-release tablets like Gralis, you should not break or crush the tablet. These tablets are designed to deliver the medication gradually into your body to maintain its levels at a significant level throughout the day. If you crush the tablet, it releases all the medication immediately, which has serious side effects. Therefore, you should be careful while using these extended-release tablets. How does it work? Communication between the neurons in your brain is mediated by a few chemicals called neurotransmitters. Many chemicals are involved in the functioning of your brain, and among them, a few groups of mediators mainly cause the activation of neurons. A mediator called glutamate is a key one in neuronal excitation. It sends the signals at a high rate, including pain signals. However, in postherpetic neuralgia, these signals are inappropriately activated due to damage to neurons. Glutamate is released from one neuron and activates other neurons. The previous neuron is called presynaptic, and the later is postsynaptic. However, for this chemical communication, the release of glutamate is highly important. Calcium should enter the presynaptic neuron to release glutamate. For this purpose, calcium channels are expressed in the presynaptic neuron. Gabapentin blocks these calcium channels. One such target is a site on the calcium channel to which gabapentin binds. This site is called the alpha-2-beta-1 site. By blocking this site, gabapentin inhibits the entry of calcium into presynaptic neurons. This leads to a reduction in glutamate release and subsequent activation of neurons. What are the precautions to be taken? Gabapentin can make you feel drowsy and sleepy. You may feel dizzy and lightheaded. These effects are particularly observed in the early days of treatment. Therefore, it is always better to carefully notice these effects until your body adjusts to this medication. Take caution with the activities that need more attention. It can also produce incoordination in your muscle movements and may cause a loss of balance. Rarely, this medication can affect multiple organs in your body. It is one type of hypersensitive reaction that may be observed in a very few people. If you observe a rise in your body temperature, rashes, or swelling of the throat, it may indicate a hypersensitive response. If you notice these symptoms, then it is better to switch to an alternative medication. Never stop this medication suddenly, especially when it is used to prevent seizures. Gabapentin inhibits the activity of neurons and reduces their excitation. When you suddenly stop taking this medication, it can eliminate this inhibition. This triggers a sudden surge of excitation in neurons that may lead to the precipitation of convulsions. Therefore, you shouldn't stop this medication suddenly. And when you want to stop taking this medication for any other reason, the dose of gabapentin should be gradually reduced over a few weeks. This minimizes the risk of convulsions. This medication can produce a few changes in your mood and thoughts. It may increase anxiety and aggressiveness. Abnormal thinking may be observed that can lead to suicidal thoughts. This effect is especially observed in children under the age of 12. Around 1 out of 500 people may experience such effects. Your doctor will periodically assess the appearance of mood changes and anxiety. However, if you find any abnormal behavior or a low mood, it is better to talk with your doctor. What should be avoided? Gabapentin makes you dizzy and drowsy. Therefore, avoid large amounts of alcohol intake while taking this medication in the initial days. When you are using a few other medications that may cause drowsiness, they should be cautiously used with gabapentin. Many antihistamines and medications used for colds may also induce drowsiness. Especially opioids like morphine, oxycodone, and hydromorphone are used to control severe pain when other analgesics are not effective. If they are combined with gabapentin, it can cause a significant depression of the respiratory system. This can cause severe sedation and difficulty breathing. Therefore, such combinations should be better avoided. A few antacids containing aluminum and magnesium salts may form a complex with gabapentin. This reduces its absorption and causes a possible delay in its therapeutic action. Therefore, it is better to avoid taking antacids along with gabapentin. You can take them 2 hours after taking gabapentin. Side effects. Gabapentin produces a few side effects that primarily affect your alertness. It can cause sleepiness and drowsiness. You may feel tired and weak. You may have blurred vision and swelling in your legs. You may also have muscle incoordination and a loss of balance. It can cause constipation and a dry mouth. Many side effects are mainly observed in the early days of treatment, and your body slowly adjusts to this medication. How is it related to GABA? GABA is a mediator called gamma-aminobutyric acid. It is one of the chemical mediators in the brain that controls neuronal activity. However, gabapentin is neither promoting its action nor binding to its receptors. Then why does the drug name include the term GABA? It's all due to a similarity in its chemical structure. Gabapentin has a structure like this, and here is the GABA moiety incorporated into it. Therefore, gabapentin is a GABA analog but not a GABA agonist. It controls the activity of neurons by blocking voltage-gated calcium channels, as we have discussed earlier. That's all, guys. This is information regarding gabapentin and how to take it. Share your experience with the use of gabapentin in the comment section below. Thanks for watching. Have a great day.